The dysphagia therapy literature research that's been done so far focuses primarily on the efficacy of specific exercises to target the various areas or disorders of physiology of swallowing that's impaired. So SLPs have a good knowledge of which exercises to prescribe to a patient that has perhaps reduced laryngeal elevation or reduced tongue-based contraction. But physical research in the dysphagia literature to date does not prescribe how many repetitions of an exercise the speech pathologist should ask the patient to do, or how much effort to exert with each exercise or each repetition, or even how frequently patients should exercise to achieve maximum benefit from their work. So I began looking into this 5 or 6 years ago during my initial years as a speech pathologist. I was especially struggling with questions that patients would ask: how many times should I do this? How should I do this? Or having trouble deciding, well, do I need to see this patient for therapy weekly? Do I need to see them daily? What role do I play after I've taught the patient the exercise? So I collaborated with a physical therapist at our university medical center to really dive deep into the exercise physiology research and into the dysphagia rehabilitation research to understand better how we can prescribe dysphagia exercises for maximum benefit. We will use this concept of 1 repetition maximum when discussing how the principles of exercise physiology relate to dysphagia therapy. Let's talk about resistive loading. I'm going to explain the concept of resistive loading with an analogy. When we swallow a sip of water, we're using only a small amount of the maximum force that our swallow muscles can generate. To increase muscle strength and the functional reserve of these muscles, we must swallow harder in therapy than we generally do with a sip of water or a bite of food. To make the muscle stronger, you have to make the muscle work harder than it generally does. This is the principle of resistive loading. As the swallowing muscles adapt to exercise, the load on the muscle must be progressively increased in order to increase muscle strength. If a person is just swallowing repetitively without effort, we cannot expect the muscle to get stronger. This can mean more effort per exercise, or more repetitions, or more sets.